I know that we discontinued the regular COVID briefings, but really we're at a new stage of the pandemic, and I thought it would be important to hold this press briefing this morning. Throughout the pandemic, for 17 months, we tried to give you, people of Ohio, the most up-to-date information that we could about the COVID-19. What we're doing this morning is in that spirit as we try to bring everyone in Ohio up to date on what exactly the medical doctors are seeing statewide. We are really at a new stage in this pandemic. I think good information is always important. And good information is even more important today, I think, than ever before. As each Ohioan makes decisions about their own health, the health of their family, and the health of others who they come in contact with. So these are the essential facts. And we will hear in just a moment from Dr. Vanderhoff, who will explain this certainly in much more detail. The essential fact is that we have 3 vaccines that are highly effective. They're so powerful that we now live in a state with 2 groups of people, those who are vaccinated and those who are not vaccinated. 2 groups of people, those vaccinated who are safe, and sadly those who are not vaccinated who are not safe. By the numbers, today 60% of all adults 18 years of age and older are now vaccinated. 40% of those adults, of course, are not. If you look at those 12 years of age and up, 58% are vaccinated and 42% are not. No fact better illustrates how powerful the vaccines are than by looking at the people who have been in our hospitals for COVID since January 1st of this year, when the vaccine first really started to have a big impact. Let's look now at this data. This is the total number of people who have been in the hospital for COVID since January 1st, 18,662 people. Of that group of people, those who were not vaccinated constitute 18,367. Those who were in the hospital for COVID who were vaccinated were 295. Just a stark difference. If you break that down by percentage, that means the people who've been hospitalized since January in Ohio for COVID, 98.4% had not been vaccinated. 1.6% had been vaccinated. Again, there's no more strong testament to the power of the vaccine. We receive this information. It's updated every week, and we will be posting this every Thursday. So everyone every week can go up online and kind of see where those numbers are. We truly have 2 Ohios. One group of people who are safe, one who are not. Making it more dangerous for those who are not vaccinated is the emergence of the Delta variant. And I'm going to ask Dr. Vanderhoff in a few moments to talk more about that from a medical point of view, but kind of the big picture. It is now clearly the dominant virus in Ohio. Going back just to May, less than 1% of lab sequence cases were the Delta variant, less than 1%. Our most recent data is from July 4th through July 17th. That showed that 86.47% of our lab sequence cases were the Delta variant. So over 86%. And Dr. Vanderhoff tells me, experts tell me that we're way above that number today. So what we're dealing with today is the Delta variant in Ohio. For those who get infected with the Delta variant, experts tell us that they very well may have a higher viral load. Again, I'm going to ask Dr. Vanderhoff to explain the real difference between the Delta variant that we're dealing with in Ohio now and what we were dealing with before. But it's really, in essence, two different things, both not good. One is it's a lot more contagious. And two is, in many cases, individuals who get it carry a higher viral load. Thus, people are getting sicker quicker. This is one of the observations that some of the doctors have made about our more younger people. When they go to that hospital, they're getting sicker quicker, and it's believed that that viral load, increase in the viral load, is driving that. Let me turn to some other data. Let's see where we are today about our county virus case rates. If we can go, Eric, to that chart. Recall that county case rates per 100,000 measure the amount of COVID-19 transmission in a particular county. When the rate is between 50 and 100, transmission is considered substantial. When that number is higher than 100, it means that the transmission level is high. You remember, we were very happy. We were seeing these numbers go down county after county, and it was continuing to go down. Unfortunately, these numbers are now back up. And if you look at this chart, what is in blue, all of those counties are 100 or above now. They're all moving in the wrong direction. All of those that are in blue are above 100. If you look at the rest of them, what you'll see is the vast majority of those are at least above 50. So again, that is not good news. Let's look at hospitalizations. We were seeing hospitalizations go down. We were very happy about that. But what this chart shows is they're now coming back up. If you look at the first number, it is July 23rd, and we had 391 people with COVID in our hospitals statewide. The last date we have is August 5th, and that number has now climbed to 857. So again, not what we want to see. So I'm going to now ask Dr. Vanderhoff to come up, and I'm going to ask him first really to tell us about the Delta variant. Doctor, tell us, what makes this different than what we have seen in the past. And I think an understanding of that and understanding how widespread that is today is something that will be useful as people make individual decisions. Doctor, thank you.
Well, thank you very much, Governor. It's important for us all to recognize that this virus is not the common cold. This is a nasty virus that can actually cause inflammation of your blood vessels and other organs. Now, across the world and here in the United States, we are seeing a number of examples of exponential growth of COVID-19. In Florida, for example, they have seen a record single-day case of 21,000 new cases, and they're actually looking at some of their hospitals having to face the choice to postpone elective surgeries. We don't want that here in Ohio. But as you mentioned earlier, Governor, we're seeing this upward trend in COVID-19 cases and COVID-19 hospitalizations, and now Delta is dominant and it is the culprit. So there are really three key things that I think everyone needs to understand about the Delta variant. One it is absolutely more contagious. And that simply means that it takes less of the virus to go from an infected person's nose and mouth to another person's nose and mouth. Now, estimates are that it's about 50% more contagious than the variant that preceded it. You'll recall we were talking about that as the Alpha variant or the UK variant. And that was 50% more contagious than the one that came before it. So what that means is that while the early variant of Delta might cause an infected person to infect another 2 people, the Delta variant might cause an infected person to go on to infect 5 to 8 other people. Another way of thinking about it is that the Delta variant is now more contagious than the common cold or the flu. Point number 2, Delta is more dangerous than prior versions of the virus. We now have data from Canada and from Scotland that show that people infected with the Delta variant have a much higher likelihood of needing to be hospitalized. And some data coming from Singapore that suggests that people infected with the Delta variant are more likely to end up in the ICU or even dying. Now, the third point, and the governor referenced this, is that there is mounting evidence that the viral loads associated with the Delta variant are higher than what we saw with previous strains of the virus. And what that means is that Delta is reproducing itself, creating more copies of itself much more quickly once it gets inside of our bodies. And this likely explains why doctors are observing more and more that, as the governor noted, Delta makes patients sicker quicker. Nevertheless, despite the fact that Delta indeed is more contagious, it's more dangerous, and it makes people sicker quicker, our vaccines remain very effective against this virus. And so I think the governor is absolutely right that as a result of Delta, Delta has created 2 Ohios. One Ohio that is vaccinated and very well protected, and another Ohio that is unvaccinated and vulnerable to the ravages of the Delta variant. Governor?
I'd like to thank you very much. Wonder, Doctor, if you could talk for a moment about decisions that people have to make in regard to the vaccine. We still have a significant number of Ohioans who have not become vaccinated. And if you can bring us up to date about the most recent information, frankly, about the effectiveness of the vaccines, side effects of the vaccines. I know we get questions about that. We get questions about other impacts that the vaccine might cause. So if you just take a moment to answer that for us.
Well, thank you, Governor. And you know, really what Delta variant is causing all of us to do is have to look at the risks it's creating and balance risks. Now, you know, we do this all the time. If I'm going out on a sunny day, I'll put on sunscreen, and I might even layer on additional protection in the form of a hat and sunglasses. In a similar way, if one were hiking in the woods, you might put on bug spray. With the Delta variant, if you're in a crowded indoor setting, potentially with many unvaccinated people, you might want to put on a mask. In addition, if you're an unvaccinated person and eligible for the vaccines, the best thing you can do is get vaccinated. Delta spreads like wildfire, and it seeks out anyone who's not vaccinated. But there's good news, and there are really 2 things that remain very, very clear. Number 1, our vaccines are absolutely the key to containing this fire and ultimately to putting it out. And secondly, vaccination is without any doubt your best bet, regardless of your age, for avoiding getting really sick from COVID-19 and for avoiding some of the lasting complications like long COVID. So, for anyone who is on the fence, trying to decide whether to go ahead and get the COVID-19 vaccine, please remember, this is not the common cold. This is a bad virus that can cause otherwise healthy children to develop a multi-system inflammatory condition that makes them very sick and puts them in the hospital for a very long time. It is a virus that has landed tens of thousands of Ohioans in the hospital and killed tens of thousands. And yet nearly all of that can be avoided by vaccination. Governor?
Doctor, thank you. Doctor, thank you very, very much. We do have other good news. We're seeing more Ohioans who are now becoming vaccinated. For example, in the last several weeks, as Ohioans have seen the spread of the Delta variant in their communities, more Ohioans are now getting vaccinated. We have seen increases of vaccinations in 85 or 88 counties in July compared to the previous month. The news is even better more recently. Last week, we saw increased vaccinations in all 88 of our counties, if you compare that to the first week of July. Additionally, we've seen our largest increases in vaccinations in our lowest vaccinated counties. Among the 22 counties that have the lowest vaccination rates, we have gone from 1,183 to 2,735 vaccinations in the last week of July compared to the first week of July. In other words, make it simple, counties that had the lowest vaccination rates are now seeing the greatest increase. This chart shows the increase in vaccinations around the state since July 4th. So that's overall statewide. Let me now go to the next chart, Eric, just to take three counties. Here you can see three counties that were lagging in vaccinations and the increases they have seen during the past 4 weeks of July. Adams County, which was 87th in vaccinations, represents the top line. They went from 42 vaccinations for the first week of July and the first week of July to 158 in the last week of July. Ashland County, which has also been low in vaccinations, is your middle line that you're looking at. They rose from 95 vaccinations in the first week of July to 199 in the last week. Finally, Holmes County, which has given the fewest vaccinations in the state, is the bottom line. They jumped from 24 vaccinations to 92. These three counties have had the three largest increase in vaccinations by percentage, so we're happy to see that. Vaccines are making the difference, and that, frankly, is where we will continue to put our focus, and that's why we're doing this press conference today. The most amazing, the most remarkable, the most effective tool that we have today is the vaccine. It is even more effective, more powerful than was ever imagined by medical professionals before it was developed. As former Trump administration Department of Health and Human Services Director Alex Azar wrote this week in the New York Times, and I quote, "The vaccines, quote, work incredibly well, and more than 160 million fully vaccinated Americans are proof of that." He also said that all the vaccines given to Americans over the past year have provided, and I quote, "provide us with some of the most robust real-world evidence of their safety and effectiveness that we've ever had for new vaccines," end of quote. I want to talk about some other good news things in regard to the vaccination, and that is a great effort that's being made by so many different organizations and people across the state. We've seen examples of communities that are working together to make sure vaccines remain readily available and accessible. Local health departments, our universities, our schools, our employers, our pharmacies, nursing homes, hospitals, community health centers, primary care physicians, pediatricians are working very hard, community after community, to make the vaccines available to every Ohioan. For example, nearly 200 of our school districts have reported having on-site vaccination clinics for students this summer. Local health departments. An example would be Tuscarawas County Health Department. Have partnered with community and volunteer groups to ensure non-English speakers interested in getting vaccinated will have access to translators. We appreciate that creativity. We know that every community in Ohio is just different. One size does not fit all. We leave it up to the local communities to make their decisions about how best to make this vaccine available. But to encourage vaccination in communities, we do let local health departments know, and we have let them know that they could use previously provided coronavirus relief and immunization funding to provide incentives to their residents. Again, this is up to the local county, but we want to make sure they understand that they can do that, and we have told them that. Some counties have teamed up with area partners to offer gift cards or discounts at local YMCAs, YWCAs, movie theaters, breweries, and more. Each county doing it a little differently. Some local health departments are focusing on educating Ohioans about the safety and the effectiveness of the vaccines. Examples, Trumbull County and Warren City health departments teamed up after they noted increasing case counts. Officials held a press conference. They talked about the importance of vaccinations and explaining how residents could easily get their vaccines at a standing clinic at an area mall where recipients would receive a small gift certificate after vaccination. And it worked. The site had been administering about 15 vaccines a day. The day after the press conference, the site administered 90 vaccinations, a record for that location. Throughout Ohio's vaccination efforts, we have seen that financial incentives can, in some cases, serve as a motivating factor for some people to get vaccinated. A study just published in the American Journal of Medicine makes an estimate that 115,000 additional Ohioans receive vaccinations as a result of our Vax-A-Million program. We're happy to help with these incentives at the state level if a county thinks that monetary incentives are the best fit for that county. We're happy to help with anything that the county thinks will work. Last night I had the opportunity to talk to our health commissioners, and we talked about our willingness to work directly with them. Whatever they think will work in their county, we want to be there to help. Every county is different. Incentives work in some counties, and incentives may not work in other counties. Let me give an example of a place where it certainly worked. On July 6th, the Columbus Department of Health, in response to declining vaccination rates, opened 10 neighborhood satellite vaccination clinics in traditionally underserved areas where individuals would receive a $100 Visa gift card for getting their first shot. Columbus Public Health laid the groundwork, getting feedback, identifying locations, canvassing neighborhoods, securing health educators to answer residents' questions. So it was a holistic approach, not just the incentive dollars, but a holistic approach. Columbus Health reported 253 vaccinations in the week of June 27th. The following week, when their incentive program began, vaccinations increased to 983. During the second week of the program, vaccinations increased to 1,491. Vaccinations continued to climb into the third week when Columbus Public Health reported they vaccinated 1,826 people. Most recently, last week, they reported vaccinating 1,814. So we want to continue to support these creative local efforts. Last night, as I said, I spoke to our health commissioners from around the state and told them that we want to support their efforts, whatever they want to do, whether it is for more incentives, such as the $100 cash card or other approaches that will work best locally. Again, where the state can help, we will. Our goal is to make it as easy as possible for Ohioans to access the vaccine. We've also talked about what we have done in regard to our Medicaid members, and that work is a work in progress. But in fact, we have already seen a 55% increase in Medicaid members 18 and older who have completed vaccinations since we issued a challenge to our managed care plans. And so that is moving forward. Additionally, we recently announced an incentive for state employees to get COVID vaccine. This is very similar to what we do in regard to the flu. It's done through our managed care with the whole idea of not only keeping people safer and healthier, but saving money as well. Let me just conclude before we go to questions. We wanted to hold this press conference today to bring everyone up to date in Ohio on exactly where we are. The name of the game today is vaccines. This is where we win. This is where we don't win. We have two Ohios. We have people who are vaccinated who are very, very safe today. We have people who are not vaccinated who are not safe. And they are more imperiled because of this Delta variant, which is more contagious and many times carries a more higher viral load when that person receives it. So it is a critical period of time. One group of people go about their business with very good confidence that they're not going to end up in the hospital. Another group of people, we cannot say that. And so individual choice is what we are about at this point in the pandemic because we have the vaccine. Schools are making choices now. We believe in local education, local schools making decisions. Businesses, hospitals, all are making decisions based upon the facts. I wanted to speak to you to make sure everyone has the facts that we have. And when facts change, we will be back to give you additional information. And in the meantime, everyone can always go to our webpage, and we'll continue to put more data up on that webpage to let people know exactly where we are.